You've been told that high cholesterol is dangerous, but recent research adds some really important context to that matters. The medical understanding of cholesterol risk assessment is constantly evolving. And again, we used to think statins, high cholesterol, that's what you do. But a large study tracking 23,000 patients found something that changes this conversation. LDL cholesterol does strongly predict cardiovascular events in people with existing coronary plaque, but patients with a 0 calcium score, that's a test that measures this artery right here and essentially tells us how much plaque might be in there. No detectable arterial plaque, the short-term association between the high LDL, the thing that everybody's freaked out about, and actual cardiovascular risk was very minimal. This is peer-reviewed published research. LDL is causally linked to arteriosclerosis, right? We know that. And anybody that tries to deny that, like, I know the beautiful story that we want to hear is that it doesn't matter, but it's not that black and white. There is a causal connection. But should you be concerned and should you start statin treatments, that's what you need to figure out. And many healthcare providers are now incorporating the calcium score assessment into their protocols. Thorough approaches allow them to make a better call on what you need to do. People with clean arteries on calcium scoring, the absolute benefit of preventative therapy is minimal, marginal, if any. So medications like statins carry great risk. There's new data looking at how they decrease GLP-1 production and increase your risk of developing insulin resistance, the very thing that you're trying to handle in order to get control of your health. So we really need to take a step back before we freak out. And if you're working with a doctor that's freaking out about your statins, freaking out about your cholesterol and wanting to put you on statins, you need to have a conversation or you need to find a new doctor. We'll see you later.